commonly contributes to cognitive impairment and is sometimes the sole cause of thinking and memory problems. Strokes, also called vascular or cerebrovascular disease, occur when a small part of the brain dies because of lack of blood. We last saw Jack in his doctor's office. She had just told him that he had mild cognitive impairment because, although his day-to-day function is normal, his thinking and memory are mildly impaired. Let's catch up with Jack now, as he and his daughter, Sarah, are continuing their conversation with the doctor. "So what's the cause of my mild cognitive impairment, Doc?" Jack asks anxiously. "I believe that there are actually two disorders that are each contributing to the mild problems you are experiencing in thinking and memory." "Two?" Jack interjects. "You're telling me that I've got two disorders? What are they?" "Dad, don't interrupt. She was just about to tell us," Sarah says. "I understand that this is a difficult conversation for you. I promise that I will explain everything and answer all of your questions, and you are free to interrupt me at any time," she says, punctuating her sentence with a little smile. Now, in someone your age, 72 years old, the pattern of very mild memory problems that you are having is most likely caused by Alzheimer's disease. I think that is the first disorder. She pauses while continuing to look at Jack. Jack nods, his jaw set. "Okay, Doc," he says. "What's the other problem?" "Your brain MRI scan shows that you have had some very small strokes, and I think that they are likely a contributing factor to your memory difficulties." "What's a stroke?" asks Sarah. "A stroke is when blockage of one of the arteries, the vessels that carry blood from the heart to the brain, prevents a part of the brain from getting enough oxygen and other nutrients. The part of the brain that is blocked dies." "What causes strokes?" asks Sarah. Two main factors explain most strokes. The first is cholesterol building up on the inside of the arteries, which causes their openings to become narrow, impeding the blood flow. The second is blood clots, which form either because the heart isn't pumping well or because the blood itself is too sticky. These clots can travel into the narrow arteries and plug them up. Strokes occur when an artery sending blood from the heart to the brain becomes blocked off. That part of the brain doesn't receive enough blood and dies. Because the problem is related to blood vessels, strokes are often called vascular disease, or sometimes cerebrovascular disease, to emphasize the problem is with the blood vessels of the brain, or cerebrum. Reduce your risk of stroke by controlling medical and lifestyle factors. "Okay, so I think I understand what a stroke is," Sarah says, "but why do people get them?" "We understand some of the factors that lead people to develop strokes. They include any type of heart disease, including an abnormal heart rhythm or having a heart attack, high blood pressure, high cholesterol, diabetes, smoking, lack of exercise, and, believe it or not, just being older." "So I know I've got blood pressure and cholesterol, but you've got me taking pills for those," Jack says. "Are they still causing strokes if I'm taking pills?" "Good question, and one that I want to talk about with you. The answer is that the risk of stroke is much less when these factors are treated. But the increased tendency toward strokes doesn't disappear entirely. In fact, because we now know that you have had these strokes, we are going to be more aggressive in treating your blood pressure and cholesterol and aim for a lower target for each. Is there anything else that my dad can do so that he doesn't have other strokes?" asks Sarah. Staying active and exercising, keeping a healthy body weight, eating a healthy diet, and limiting alcohol will all help reduce the chances of having another stroke.